A nurse who self-diagnosed herself with a blood clotting disorder has revealed she was fitted with a pacemaker at 25 because of another sinister heart problem. Ms Barber, from Long Island, began experiencing shortness of breath after just walking upstairs as well as pain in her leg. Doctors confirmed Ms. Barber's own beliefs that she had deep vein thrombosis and a clotting disorder called prothrombin gene mutation. This condition, coupled with her recent surgery for gymnastic injuries, was causing blood clots throughout her body, making it difficult to move. But while having physical therapy, Ms. Barber was having episodes of dizziness that would leave her unable to stand. In the hospital, scans revealed she also had an abnormal heart rate, diagnosed as junctional rhythm, which had caused a fluid buildup in her lungs. There were no other options for Ms. Barber other than to have a pacemaker, which left her feeling deflated considering she treated patients with them who are typically over 75 years old. Ms. Barber, who had her pacemaker fitted this month, said, "Being 25 years old, I was hesitant to get a pacemaker, but the unpredictability and symptoms associated with this abnormal heart rhythm was significantly affecting my lifestyle. I was very nervous and honestly angry. I wondered why these things keep happening to me. Whenever I thought I was improving, something else seemed to interfere with my recovery." It seems vain, but being a young female, I had some concern for aesthetic appearance of a pacemaker. I thought it might look weird when wearing a swimsuit, for example. Ms. Barber was a talented gymnast as a child and was always active. At the age of 13, Ms. Barber fractured the growth plate of her right hip while on the tumble track, and in 2018, a CT scan revealed a torn labrum caused by gradual wear and tear. Ms. Barber said, "My orthopedic surgeon felt that, over time, bone degeneration led to wear and tear injury of my right labrum. In March 2018 I underwent right hip arthroscopy to repair this, and for 2 weeks I was non-weight bearing and using crutches. I was then cleared by my surgeon to begin physical therapy. But a month into her recovery she was experiencing shortness of breath, and with her own background in nursing, Ms. Barber began self-diagnosing. She said, "I was regaining strength when I noticed shortness of breath while climbing the stairs. Being a nurse, I started to wonder if this could be deep vein thrombosis, DVT, or pulmonary embolism, PE. I never thought something like this would happen to me, but I went to the hospital just to be safe. Well, I'm glad I went because it turns out I had a right leg DVT with bilateral PEs. I was found to have a clotting disorder called prothrombin gene mutation that causes my body to favor clot formation. This condition combined with the recent surgery was the probable cause of clots in my leg and lungs. Arrhythmias are experienced by more than 2 million people a year in the UK, while it is estimated that 4 million Americans suffer from recurrent irregular heart rhythms. After spending weeks in physical therapy, Ms Barber was experiencing bouts of dizziness, so by September 2018 she returned to the hospital. She said, "I was in physical therapy and on the road to recovery when I met another obstacle. I noticed these sudden episodes of dizziness that would come and go. Sometimes they could happen daily and last the entire day. Other times I could go a week or two feeling fine. I felt as if I couldn't get up from my bed. I was weak and couldn't stand for more than a few minutes at a time." After her diagnosis of a heart defect, Ms Barber was kept in hospital for 8 days receiving IVs due to low blood pressure. She said, "The next day, I developed chest pain and difficulty breathing. A chest X-ray revealed fluid in my lungs, requiring oxygen for a few days. Ms Barber tried various medications to avoid a pacemaker because of her young age, but inevitably there was no better option. A pacemaker consists of a generator, which is a small device placed in a pocket under the skin and connected to the heart with 1 or 2 thin wires. It sends small painless amounts of electricity to the heart to make it beat." Ms Barber said, "Initially, my doctors wanted to try adjusting medication to avoid pacemaker implantation in such a young patient, but it was my next and only option." By February 5, 2019, I was ready to get my life back, so I had a Medtronic Azure pacemaker placed. As a cardiac ICU nurse, I'm accustomed to seeing patients with pacemakers. Most are much older, but there are a fair share of younger patients also needing these devices. It seems that people without formal medical training don't understand the purpose of pacemakers, and more importantly, the normal lifestyle that one can give now. Ms Barber hopes to show that pacemakers aren't solely for older patients, as she had once thought. She said, "When I told people I was getting a pacemaker, or now when people find out I have one, they're shocked and often tell me I'm too young for one. It gets a little frustrating to hear that. I've noticed more energy and no episodes of fatigue or dizziness related to junctional rhythm. Overall, the device is doing its job, and I no longer have the fear of dizzy episodes. Despite the hardships, which may seem unfair for someone my age, it's important to remain positive and consider that many others have been through similar procedures and come out with a better quality of life."